So going from IUI to IVF is like climbing and stair. Like a person chooses their line, like what they are going to do further in their life, their career. So it is like same for the patient, because IUI is one thing that doesn't disturb the patient. IUI is like a natural thing. Patient thinks nothing much is going to happen, not much money is being involved with it. So when should a patient go from IUI to IVF? First, when you have recurrent IUI failures. Usually if you have already gone for 3 IUI cycles, you should not go for a 4th IUI. You should definitely go for a IVF cycle. If the condition of the tube is dubious, means only one tube is open or somewhere you are seeing thickening in the tube, then maybe you can try one IUI cycle. After that you should go for IVF. Thirdly, if your AMH scores are really low, if you have low egg reserve, you should definitely go for IVF. If you have tried one IUI cycle, it is more than sufficient, because every time you are undergoing an IUI cycle, every time you are being stimulated and you are already having low AMH, so the time period is already less for you, your clock is ticking. So these patients should switch to IVF as soon as possible. Fourthly, patients with endometriosis, because they have problem with the egg reserve. So all patients who are dealing with problem with eggs, they should not try more IUI cycles. They should jump from IUI to IVF cycles as soon as possible. So basically patients who are having male factor, means if you are going with donor sperms IUI, or the sperm count is borderline on the lower side but not that low, they can try for recurrent IUI cycles. Rest all patients, maximum 1 to 2 cycles, you should jump to IVF as soon as possible, because that will increase your IVF success rate, your eggs, your embryo, numbers of embryo. Because once you start the IVF cycle, then you know that IVF also has failures, you might require more attempts. So if you have got more embryos, those attempts are like every time the ovum pickup is not done. So these kind of patients, they should jump from IUI to IVF as soon as possible. We care about you.